Dr. Poteet, thank you so much for joining us today. Just have a couple of questions for you. So, my first question is, in one or two words, can you describe what comes to mind when you think of practicing urology independently?
The main two things that I would kind of say that come to mind are both opportunity and freedom. Freedom being, you're free from a large healthcare system, so you can kind of make the decisions you feel are best for your patients without somebody kind of being involved in them. And then freedom, kind of same thing. You have a lot of freedom within a private practice, freedom to make treatment choices for your patient that you feel are best. And some of those things are a little bit different within a large healthcare system, or if you're an employed physician.
I know you talk a lot about growing up watching your father practice internal medicine. Do you think watching your father practice was a crucial part of your desire to go into urology? Would you say it gave you an edge when pursuing your medical education?
So I would definitely say that it influenced me very strongly to go into medicine, not necessarily urology. Watching internal medicine physicians, being the primary care physician, they have very close relationships with all of their patients. By default, by definition, they're the primary care provider. So I knew I wanted something like that with my patients, as opposed to another profession, another specialty like anesthesia, where you might not, see your patients more than once or twice. As far as, medical school, certainly, it definitely made it much easier having somebody that could, provide guidance and had already kind of been down that track.
So along those same lines, how do you think, or do you think that kind of having this inside knowledge of internal medicine aids you when dealing with your patients as a urologist?
I think it's very important. I think it definitely helps to have an appreciation for, kind of the interplay of chronic diseases and the whole health of the patient, especially in light of kind of our narrow specialty. There's relationships between, we all know these, relationships between nocturia and sleep apnea and things like, hypertension and vascular disease and erectile dysfunction. And so kind of having an appreciation for the, whole health aspect of a patient is, I think extremely helpful. It also really just kind of helps to understand, what a primary care physician does and kind of what they go through. It's in some aspects definitely a somewhat thankless job. And as specialists, we have a narrow area to focus on, and so it kind of always helps to remember that if we're dealing with two or three problems for the patient, they're dealing with 20, and so it's easy to say, oh, they missed this, or this didn't get done, but they're dealing with a lot of different things, and we kind of have a narrow window of things that we have to work on. So I think it's very helpful to both help with our patient care and to keep good relationships with our referring providers.
So are you or your practice working on any cutting edge therapies or treatments right now?
Being part of a large group, there's definitely cutting edge things that are going on. I myself am not a first adopter. I don't like to kind of be the first to use the technology right when it comes out and kind of make my patients guinea pigs, but I'm a little more conservative on that. But within a group like ours, we have people that are specialized in certain areas of urology, and they definitely are doing things that for instance, the um, all of the newer robotic procedures and things that are kind of, you know, being done at academic facilities, they're being done within our practice, which we get to, a little bit later in the interview.
One thing that I've noticed when just talking to people out in the public, men over the age of 50, over the age of 60, and I asked them, do they have a urologist? Many of them, including my own father, told me no, and he almost rebuked me like, "No, I don't want one. I don't want a urologist," and he's 65. So that leads me to my next question. Why do you think that so many men are reluctant to see a urologist, even well into their 60s? And have you experienced this personally?
Sure, but in general, I think a bigger aspect of it is just men are reluctant to see doctors in general. I don't even think it's necessarily confined to the urology space. I mean, there's a lot of, guys that are just dragged kicking and screaming by the wife or family, or whenever they show up, kind of on death's doorstep, that's whenever they'll finally get in to see someone. So I don't think it's necessarily just confined to urology. And some guys may, go their whole life and never need a urologist, and that's perfectly fine. So I mean, uh, we don't need to see every guy in the world, and we don't have time to see every guy in the world, and that's also okay. But yeah, I mean, guys in general are just reluctant to go get care, um, for anything. So I don't think it's necessarily just urology.
Do you have any advice that you use or that someone else could use to persuade older men who probably would need to or could benefit from seeing a urologist to go?
So I think that in general, what I would focus on, I can only reach so many men, but to go back to the primary care doctor, what I usually try and focus on is whenever I talk to primary care physician is to encourage them to send their patients over. If they think that they, have a urologic issue, I tell them, just send them over. We're happy to see them. We're happy to kind of work it up and see what's going on and take care of it. And, take one thing off your plate. And if you can influence one primary care doctor, you might reach out to 2 or 3 thousand men just through one doctor. And so that's kind of where I've always thought was a little more bang for your buck. The other thing is I'd probably say is that um, you know the younger generations are getting better about that. There's certainly more of a focus on being health conscious and exercising and eating better in some of the younger generations. So hopefully that'll be something that kind of changes as a paradigm over time.
Yes, let's hope so. So I want to talk a little bit about your history with residency. How do you think the field of urology has changed or evolved since you were a resident?
I mean, dramatically. I'm not that old. When started residency in 2006, and that was kind of at the forefront of robotics, and we didn't really know if kind of that would take off or not. Some residency programs had a robot, some didn't. And now it's pretty much standard of care. Most operations that are minimally invasive are done robotically, and probably should be. Um, Another aspect is the therapeutics and the oncolytics. The pharmacologic side has just really exploded over just the last 10 years, which also has enabled us to keep more of the patients in the urology sphere as opposed to sending them over to oncology. And I think that's been very beneficial for both urologists and our patients.
What would you say to a resident who wants to work in independent practice?
My general advice on that would be, you need to think long term, lifelong goals. Kind of where do you see yourself in 10, 20 years? um, you know pick a job based on the people and the culture and kind of where you fit in, and not just for a salary or benefits, or what you think is a work life. Because if you enjoy your job, you're certainly going to be happier at it and stay at it longer. And so those are certainly the things that I try and focus in on whenever I talk to interviewee candidates that we have coming straight out of residency, because it's certainly hard to kind of compete with what the big systems can provide for benefits package or starting salary. But um, for most people, being when we've reached kind of the pinnacle of what we do at this point, um, not many of us are happy being just kind of a cog in a wheel. And so independent practice lets you explore way beyond that, whereas just becoming an employee does not.
Is there a procedure or a treatment or anything like that that you would really look forward to teaching an incoming resident? Because I know you said things have changed so drastically. So are there certain things that you would say, okay, this is something you need to learn right away?
There are some, I think that, getting access for PCNL is something that urologists should be familiar with, and sometimes that's not taught. But in a bigger scope, I wouldn't focus in on, if somebody new came to the practice, I wouldn't focus in on, what can I show them, training wise or medical wise. I mean, they're coming out well trained. Everybody coming out of urology residency is usually a good doctor and a good surgeon. The things that are a little bit, I think, more helpful is kind of, day-to-day workflow and, the business side of it, coding side, and, things that kind of make your life easier and better. Most guys coming straight out of residency or girls are, fantastic doctors. And so I certainly wouldn't step in and say, watch how I do this. But I think it'd be helpful to say, look how I code this, or look how, my schedule runs. And I think those are things that are, a little bit more useful.
Yeah, so there are actually some things that we are working on for our upcoming resident summit, talking more about the business aspect of practices. So I want to just ask, what is the most complex procedure your practice performs?
So again, it's really fun being a part of, a group of almost 30 physicians, because we have very general urologists such as myself, and we have people, that are very subspecialized, and, so we pretty much, there's not much we don't do at our practice that isn't done at academic centers. We're doing, cystectomies with neobladders. We have guys doing complex robotic reconstructions using, buccal mucosa out of the cheeks. I mean, it's again, if you can kind of think of it, there's probably somebody in our group that's willing to try it and do it.
So we know there are opportunities for residents and incoming physicians to pursue subspecialties, but a lot of them we're finding out they still think it's only possible in academics. And you've just said you guys do mostly the same things that are done in academics. But what do you think can be done to change this sort of this idea that you're limited when you go into private practice?
So, we've been interviewing some people fresh out of residency, and everybody coming out of residency, again, is very broadly trained. The days of, having to be limited to subspecialties, 15 years ago when, robotic training wasn't common and those kind of things. So, those are kind of over. So we try and, let the candidates coming out know that they can practice however they want to. If they want to do everything, we're happy to have them do that. If they want to kind of specialize in an area and focus in on something, we have general doctors that might refer into their specialty practice. So being part of a large group does kind of allow for the opportunity to focus your practice as you kind of want to design it, and that can be very broad or very narrow.
So how has the COVID-19 pandemic changed your practice, or has it?
I think everybody would say that it's changed their practice pretty significantly. Everything from the mundane and, seeing patients in telemedicine and, wearing masks everywhere throughout a clinic to, business side issues such as keeping staff. I think that's kind of a broad problem, not only in, urology or medicine practices, but, kind of any business right now. There's, medication and supply chain shortages. We had issues getting, our pharmacy approved in a timely fashion because of the pandemic. I mean, there's just limitless changes, and we've, done pretty well and tried to persevere through most of those. And, hopefully we're on the track to getting back to normal.
What would you say is the best benefit to your LUGPA membership?
Having only been part of a large group for about the last 2 years, I'm just kind of starting to explore that. I'm going to be part of the leadership program this year, so I think that'll be extremely beneficial. We have access to a lot of data, so we can compare our group with other large groups. I think that's very helpful from a business standpoint. We're able to collaborate right now. We're collaborating with one of the other large groups in Texas to kind of get our pharmacy up and running. And so, I mean, it's a, extremely collegial environment. And I think that's really nice and neat for doctors to be able to interact on that kind of level. So I think it's going to be fantastic going forward.
You speak very fondly about learning from your father as a child. If you could tell me one thing that you carried over from your experience with your father to the mission of your practice, Urology Partners of North Texas, what would that be?
And nicely enough, it's already kind of dovetailed whenever I walked in. What I took away from my dad was, patient first care, do the right thing, and one of our, group, group core principles is, patient first care. And so, I walked into a group that already has that, and most doctors are, centered around that anyway, which is, what we're supposed to be. But growing up and, watching somebody live it is a powerful example. and reminder, whenever he retired about 5 years ago, they had a going away party where they had the patients come and say bye if they wanted to. And, the door stretched around the block. The line stretched around the block. It was, a 4-hour procession of people coming in and alternately thanking him and being mad at him for retiring because they had to go see someone else. So, that's something I can always, strive to be like.
That is really great. Well, Dr. Poteet, thank you so much for sitting down and talking with me today. We really appreciate you taking the time. And good luck on working with the Executive Leadership Program. Look forward to seeing you with that. And so that's going to conclude the interview. Thank you.
Fantastic. Thank you.